everyone, welcome or welcome back to Sowkya Vision. Today in this video we are going to discuss the Norma Lateralis. We have completed a discussion on Norma Verticalis, Norma Occipitalis, Norma Frontalis. Today we are going to start with Norma Lateralis. Yes, first of all let us see what are the bones that are involved in the formation of Norma Lateralis and the sutures, main sutures in the Norma Lateralis. First of all, let us see in the diagram, then we will go to the description. Okay. Now, what are the bones? The bones involved here are this is frontal bone, right? Frontal bone, parietal bone, this is parietal bone, right? Occipital bone, and here is the temporal bone, we know. Sphenoid bone is also involved in the formation of Norma lateralis. We can see in the lateral side of the skull. This is a zygomatic bone, right? Zygomatic bone, mandible, maxilla, and the nasal bones. All the bones, mostly all the bones are involved in the Norma lateralis. What are the bones once again? The frontal bone, parietal bone, occipital bone, temporal bone, sphenoid bone, zygomatic, maxilla, mandible, and the nasal bones. Yes, these are the main bones that we can see in the lateral view of the skull, that is Norma lateralis. Yes, what are the sutures? The main sutures are the lateral part of the coronal suture. Where coronal suture is passing? It is passing from lateral, from the one side of temporal region to the other side of temporal region, that is connecting two parietal bones with the frontal bone. Yes, and peritosquamous suture. Peritosquamous suture. And the last one is the lambdoid suture. What is the lambdoid suture? It is presented posteriorly. It is present posterior aspect where it connects the two parietal bones with the occipital bone. Yes, these are the main bones and sutures that we can see, that we can appreciate in the lateral aspect of the skull in the Norma lateralis. Yes, what are the bones I said? The frontal bone, this is the frontal bone, parietal bone, the parietal bone, occipital bone, temporal bone, sphenoid bone, zygomatic bone, mandibular, maxilla, and the nasal bones. Yes, these are the bones involved in the lateral view of skull. We can appreciate in the lateral view of the skull. What are the sutures? Coronal, peritosquamous, and the lambdoid suture. These are the bones and the sutures. There are some other important features that can be appreciated in the lateral view. What are they? The temporal lines. Temporal lines. These are the lines that are present on the temporal bone. See, these are the temporal lines. One temporal line splits into superior and the inferior temporal line. This is the superior temporal line and this is the inferior temporal line. Now, zygomatic arch. This is the zygomatic arch. Yes, the zygomatic process of temporal bone and temporal process of zygomatic bone are involved in the formation of zygomatic arch. And external acoustic meatus. See, this is the external acoustic meatus. Yes, mastoid process. It is a process that is extending part of the temporal bone. It is a mastoid part of the temporal bone. This is a mastoid process. Yes, this is a mastoid process of the temporal bone. Now, asterion. Asterion is mummy-like process of the temporal bone. Asterion is the meeting point of peritomastoid, occipitomastoid, and lambdoid suture. Asterion is nothing but the point where occipitomastoid, peritomastoid, lambdoid suture meet. This is the occipitomastoid, peritomastoid, and lambdoid suture. The point where the three sutures meet is known as asterion. Yes, now temporal fossa. It is a fossa, shallow-like depression that is seen on the temporal bone, that is from lateral side we can appreciate it. It is presented in the lateral aspect. Here somewhere it is presented. It is a shallow depression. And another feature is what? Pterion. It is a H-shaped. It is presented as H-shape. It is formed by frontal, parietal, temporal, and greater wing of sphenoid bones. Yes, pterygium. This is a pterion. This point is a pterion where frontal, parietal, temporal, greater wing or sphenoid meet by forming sutures. By their sutures is known as pterion. So, what are the main bones that are involved in the formation that we can appreciate in the lateral view of the skull? Frontal, parietal, occipital, temporal, sphenoid, zygomatic, mandible, maxilla, and nasal bones. And the sutures are coronal, peritosquamous, lambdoid sutures. And what are the main features other than bones and sutures? Temporal lines. The temporal line is divided into superior and inferior temporal line, and zygomatic arch formed by zygomatic process of temporal bone, temporal process of zygomatic bone, and external acoustic meatus, mastoid process asterion, temporal fossa and pterion. This is the Norma Lateralis. If you have any doubt, please comment in the comment section. If you have any question regarding this, and if you want any explanation of any part, please comment, like the video, subscribe to the channel. Namaste.